Here we have a humerus. I can tell that this is a left humerus because this head of the humerus has to face medially, and this lesser and greater tubercle kind of face anterolaterally. So I know that this is going to be on the anterior side. There's also a lot more stuff on the anterior surface at the distal end. On the posterior side, there's just this olecranon fossa that's really prominent, and that's going to help tell you that that's your posterior side if you're looking at that. So let's start at the top. So as we said, we have the head of the humerus. This line around here is the anatomical neck. And then the surgical neck is this line down here. It's kind of maybe a messed up thought, but I imagine if I had a saw and I wanted to cut this, where would I cut it? And this looks a lot more cuttable. So next we have our lesser tubercle here in green, the greater tubercle here in blue. And then this line here is the crest of the lesser tubercle, whereas this red line is the crest of the greater tubercle. And then this orange in the middle is the intertubercular groove or bicipital groove. Either one, they're kind of synonymous terms there. We have the deltoid tuberosity, which is kind of anterolateral. It's not directly lateral. It kind of varies if you actually look on a real bone. And then we have the radial notch or the spiral groove. Next, we have the coronoid fossa and the radial fossa. These are both there so that the ulna and the radius can fit and get more flexion so they don't run bone into bone. Here's the trochlea, which runs all the way back over to here. That's where the ulna inserts or attaches. And then here's the capitulum in green where the radius sits. Here's a lateral epicondyle and lateral supracondylar ridge. And then medial epicondyle and medial supracondylar ridge. And then final thing is the shaft. So this entire section all through here is the shaft.